Well, San Diego's first milk bank is opening today, providing pasteurized donated breast milk for premature or sick infants in need. And joining us with more on this historic opening is Mother's Milk Bank Executive Director and San Diego Blood Bank Medical Director, Lisa Stellwagen. Good morning, Lisa.
Good morning.
Well, thank you for joining us. This is really historic for people who are unaware. This hasn't really been done, and this is going to be providing donated breast milk for the entire state of California, as I understand it.
Yeah, so there's only 30 milk banks in all of North America, and there's only been one in the state of California, up in Northern California. And so Southern California did not have a nonprofit milk bank until just early September, when we started producing milk with our UC San Diego Health Milk Bank.
This is incredible. And so today is the official start date of this, correct?
Right, correct.
And you know, as a mom who breastfed, it was always important to be conscious of what you were putting into your body, and you worry about different things, and they even have tests now for if you drink, if there's too much in the breast milk, you know the whole deal. But I'm sure there is a way that you are providing some peace of mind for moms of these sick infants, that the breast milk is safe.
Yeah, so this is really a critical issue. This milk that's being donated by mothers that have excess milk is being processed and tested and fed to the tiniest of premature babies in the neonatal ICU. Some of these babies only weigh 1 pound, and they're just getting little tube feeds of a milliliter every few hours. So this milk has to be perfect. So even though a lot of moms are on medication or maybe have an occasional drink of alcohol, the moms that donate actually have to take it to a new level in terms of their health habits and even the cleanliness with which they handle the milk. And then on top of that, we do blood test screening and an extensive questionnaire of these mothers and keep in contact with them throughout the time that they donate to us, which can be up to the baby's first year of life.
That's incredible. And NICUs across the state historically have not really utilized this donated process, right?
Yeah, you know, it's been a moving target. So we've had the scientific evidence that getting an exclusive human milk diet when you're born so little, if you're born less than 3 pounds, leads to much improved outcomes. And that should be mother's own milk. But a lot of these moms that have those tiny babies are quite ill. They have high blood pressure, C-section deliveries. They can, you know, and this time they could have COVID, and they don't always make enough milk. And so we've learned if we top them off with pasteurized donor milk, they do much better than babies that get topped off or given formula. It's estimated that about 70% of the NICUs in our state are using donor milk for their premature babies, but it should be 100%. And that's one of our goals, is to address that disparity and make sure that every NICU in Southern California offers pasteurized donor milk to their patients.
And you know, you mentioned COVID, and with this pandemic, you're actually seeing that more moms are able to donate because they're working from home. Because most moms know the second you go back to work and you're trying to pump and do all of this, it really dries up your supply. So this is really kind of a benefit of COVID, if you will.
Unbelievable. You know, when we opening this milk bank during the pandemic, it was never in the plan. And so we were very worried that people were going to go into hiding and not donate milk. And even before we were opening, we were starting to collect milk, and we started seeing all this milk come in. Our freezers are full, and we've only been processing milk for 12 weeks. So I think a lot of women had saved up a stash to go back to work and then didn't go back to work. But, you know, a lot of our donors are women who pump just to donate, that they feel so passionate about the importance and the biology of mother's milk that they pump to donate intentionally. And it's just this amazing gift that women give to other families to help those children thrive.
It really is, because we know how much it can help our critically ill preemie babies. So if there are women out there who want to learn more about this, are they able to sign up to donate? How do they get involved in this bank?
Yeah, well, you know, one of our goals is to make donation easier. It's traditionally been a little difficult, can take many weeks to get certified. So we have a web portal, an interactive web portal that we set up, and people can go to that portal. It's ucmilkbank.ucsd.edu. And we really aim to make the process easy and to allow mothers to get certified within just a few short weeks. And then our location, we're owned by UCSD, but we're located at the San Diego Blood Bank. So that drop-off is at the San Diego Blood Bank, and hopefully in the future, when things open back up, the drop-off can be in the community sites as well. and help us serve the community better.
Fantastic. Well, this is historic and quite the honor. So, Dr. Lisa Stellwagen, thank you so much for joining us, and congratulations on getting this going.
Thank you, and thank you for having me today.
Absolutely. Well, if you are not ready